Hi, I'm Garnet Gilmore. I'm the Director of Marketing and Sales at Warwick Forest, your premier sponsor for the Lifelong Learning Society. Today we're filming from our movie theater. During COVID, we've been able to use our movie theater. We are asking residents to mask and social distance, and then they can enjoy a movie together. We hope that you come and take a tour so you can see the rest of our amenities here on campus. Today I'm introducing Dr. Ramakrishnan. After earning her MD and PhD at Albert Einstein College of Medicine in New York, Dr. Ramakrishnan completed fellowship training in vascular neurology at Brigham and Women's Hospital and Massachusetts General Hospital. She also completed a fellowship in interventional neuroradiology at Emory University Hospital and Grady Memorial Hospital in Atlanta. Dr. Ramakrishnan is board certified in neurology and vascular neurology by the American Board of Psychiatry and Neurology. Recognized by Coastal Virginia Magazine's 2016 Top Docs list, Dr. Ramakrishnan is not only a highly successful neurologist and neurointerventionalist, but also an accomplished author, clinical research investigator, lecturer, and educator. A kind, caring, effective, and fully engaged physician, she is an expert in treating problems of the brain and spine blood vessels in minimally invasive ways and with medicine. Dr. Ramakrishnan enjoys the seasons, history, arts, and cultural venues of Virginia. Her favorite hobbies include traveling, reading, exploring other cultures and cuisines. Thank you, Dr. Ramakrishnan.
Well, should be showing up. And they're going to go through the slides for you. You can just say
next time.
Yeah.
Hi, good morning. Thank you very much for that introduction, and thank you for giving me the opportunity to be here today and talk about stroke. So this is a fundamentals of stroke in a fashion that's very consumable for everyday application, and that's the goal of this talk. You know, it shouldn't go over, so we can always make time at the end for questions, or if there are any pressing questions, by all means raise your hand and we'll see what we can do. All right, so stroke, how big is this a problem? Is this a rare disease? Is this common? Well, it's actually a very common problem. It doesn't have to be this way, but that's the reality. It's a neurologic emergency. Every year, about 795,000 strokes are diagnosed in the US. We don't know the people who don't come to the hospital, so that number does not reflect those who stay at home. Stroke is now the 5th leading cause of death in the US, but it is the #1 cause of long-term disability in the adults. 3/4 of the strokes occur in those over the age of 65. What does that mean? 1/4 of them actually occurs in those younger. If that's a surprise to any of you, sadly, it's not for what we do every day at the hospital. We see a lot of young people too. So stroke doesn't really care about the age. What it really makes a difference is what your risk factors are, and we'll get into that in a minute. The risk of stroke doubles every decade after the age of 55. So, you know, age is just a surrogate. It's not the determinant, but it is a surrogate for a stroke risk. If you look at the map of the US by county and look at those who are over the age of 35, it shows you how many people die because of stroke. This map says it was derived in 2011 to 2013, census map from CDC for stroke. But you know, looking over the years, every 2 years they update this map. We only gotten more purple. More purple means more people are dying because of strokes. And if you look in Virginia, this area is very purple. And we are in the stroke belt. The states that are all purple, all the southeastern states, parts of Texas, Alabama, Missouri, and so forth, all these states are exceedingly purple, telling you what a toll stroke takes in the population here. So stroke, as I alluded to earlier, is a problem that affects most of us. One way, shape, or form, either directly or because of the people that we have to give care who suffer from stroke. However, it is a preventable problem, and if you look one of the spokes of the slide, it tells you that 80% of the stroke is preventable. So I will be spending some time talking about the things that you can do to better protect yourself. Other highlights that are things that we should really focus on, it's a very expensive problem. In 2010 dollars, strokes cost about $73 to $74 billion just for direct costs. This number has increased over time, and it's expected to increase furthermore. About 60% of strokes happen in women, 40% in men. And you've seen some of the other numbers before. So it is a big problem that affects us all. It's important to keep that in mind so we take it seriously. There are lots of misconceptions about strokes, and then it's important to recognize those and then acknowledge what we can correct about those misconceptions. The first one is that stroke cannot be prevented. And as I just showed you, it is a highly preventable disease. 4 out of 5 strokes can be prevented. There is no treatment for stroke, another misconception. Can't do anything about this. Actually, you can. If you seek immediate, timely attention by calling 911, if you recognize any concerning symptom that might be a stroke symptom, call 911 because there are time-sensitive treatments. If you think about it the way you would think about a fire, you'd want to put out the fire as soon as you can. Stroke is akin to that in a way because it destroys brain. So the sooner you seek attention, the less brain damage you would sustain. So calling 911 right away is key. Stroke only affects elderly. That's actually not true. You saw that stroke can happen to anyone at any time. Stroke happens in the heart. Well, heart might be a contributing factor to stroke, but stroke happens because of a disruption to blood flow in the brain blood vessels, also known as a brain attack. Well, if somebody has a stroke, you can only recover in the first few months and then you stop making progress. That's actually not true. Your brain learns all through your life. That's why we are able to learn so many things over the course of our life from when we were born. We learn how to walk, talk, go to school, get an education, learn tasks, skills, hobbies. Over lifetime, we never stop learning. So recovery for stroke is learning how to do what was lost. So stroke recovery can happen lifelong, but you need to keep at it. Another misconception, strokes are rare. Strokes are actually very common. 7 million stroke survivors exist in the US. And when this slide was made by this organization, stroke.org, it used to be the 4th leading cause of death. Now that we have made some progress, it's pushed down in the cause of death rank list, but we have not really made too much in the way of progress for decreasing the overall number of patients, survivors with strokes, meaning those who have not beat the stroke. Strokes are not hereditary. There are very few strokes that are hereditary, but the way I'd like us to encourage thinking about this is habits are learned over a lifetime. We imitate and adopt habits that we see in our families. Some of them can be good, some of them can be detrimental, and the way we make food is one of the things that we learn from families. And if you're used to eating things that were made a certain way and engage in unhealthy habits because you've seen family members do the same, then to say that stroke runs in the family perhaps is right in a social way, but not in a hereditary way. So it's a little bit of a more nuanced matter to say strokes are hereditary, but in a genetic sense, transmissibility of stroke is pretty rare. How you lead your life and what habits you have and what risk factors you have a greater determinant on your stroke risk. If stroke symptoms go away, you don't need to see a doctor. Many of the patients that we see after more than a few symptoms actually fall in this basket. They ignore the symptoms because it's gone away and they dismissed it. Actually, when somebody has a temporary sign of a stroke symptom, it's a wake-up call to seek immediate medical attention. Drop everything and call 911 and, get attention, because the next time it may not be temporary, it may be permanent. Temporary stroke symptoms are called TIA, and they need to be taken seriously so that you don't have a permanent deficit. Okay, so we talked about stroke being a neurologic or a brain emergency. Strokes happen due to disruption of blood flow, either due to blocked arteries or due to bleeding brain blood vessels. And they both require immediate medical attention. And as I said, 4 out of 5 are preventable. And many strokes are treatable. So we're going to look at ischemic stroke, which is what happens when you have a blocked artery that's supplying the brain. So here is a cartoon of multiple arteries sending blood flow to the brain. And this area has a blockage. You can see this branch point being magnified here with a blood clot sitting at that bifurcation, compromising blood flow to this brain, which is turning purple, just like, if you sat on your hand, it turns purple after a while because you've cut off blood flow. Well, the same thing happens to the brain. That's called an ischemic stroke. And the blood clot can come from anywhere. It can come from the heart. It can form in the arteries on the way of blood flow to the brain. It can form in the blood vessel within the brain itself. A bleeding kind of a stroke is the same idea. You have blood vessels on the leathery covering of the brain, in between the coverings of the brain, on the surface of the brain, and so forth. So blood vessels can spontaneously rupture if they have weak spots. They can also rupture if they have things like an aneurysm, which is a bubble on a blood vessel, which keeps growing, and eventually ruptures. Or you can have a tangle of abnormal blood vessels that can rupture as well. So you can have hemorrhagic stroke, which is a bleeding kind of a stroke, and again, a neurologic emergency. All right, so moving on. So we'll talk a little bit in more detail about what an ischemic stroke is. Ischemic stroke and TIA, which is a warning sign of an ischemic stroke, happens due to blocked blood vessels, which compromise blood flow to the brain. And, if I hold my breath, close my nose and my mouth, I'm going to suffocate due to lack of oxygen. And that's not a sustainable way to live. I'm going to die if I did that. Imagine the same thing happening to the brain cells when blood doesn't reach those areas because there's a blockage. Those areas of the brain die, and it doesn't take very long for those areas to die. Brain doesn't tolerate lack of oxygen or glucose. So the manifestation of the blockage to the brain blood vessels results in weakness, numbness, speech impairment, difficulty seeing, understanding, walking, maintaining balance, any number of things that are controlled by the brain, and the symptoms derive from which body part and what function that area of the brain controls. Okay? So regardless, when it's cut off, the blood supply, the brain stops functioning and you have symptoms. How big the symptoms are intuitively makes sense. If you have a large area of the brain whose blood supply is compromised, you'll have a large stroke. But the opposite does not follow. If you have a small area of the brain that suffered the damage, doesn't mean that your symptoms are negligible. It depends on the location. So let me give you another example to illustrate the point. If you have fallen trees in a very sparsely populated area, like in the mountains or someplace where people don't live, the disruption to traffic flow is very minimal because people don't really live there. It can be, less disruptive to the local people. But if you have a roadblock on 64 in our area, it's a highly densely populated region. It affects a lot of people. So it might be a small geographical area, but if it's a high real estate value for the brain where lots of things are happening, a small stroke can still result in a large deficit functionally. So you can't really say small stroke, large stroke. It really depends on how compromised you are because of the stroke. Okay, so let's now talk about TIA. TIA is a transient neurologic impairment, transient ischemic attack due to a blocked blood flow. People call it as a mini stroke, but it's not a diagnosis. Mini stroke, you can imagine some people say mini stroke to indicate that a small area of the brain was affected when they suffered a stroke. But that's not a TIA. So instead of using words that can be very confusing, a stroke is when you have evidence of dead brain on some imaging study, even if you've made a recovery. A TIA, on the other hand, is like a cat burglar that comes, takes what they need, and left without leaving any evidence, and you got better from it because you replaced whatever was missing. But nevertheless, you know that you temporarily suffered some symptoms that were neurologic in nature. No evidence left behind. That's a TIA. So I would not use the word mini stroke. I would use either a stroke, where you have an evidence of an abnormality in the brain, goes along with the symptoms you had, or a TIA where you had an abnormality and no brain scar was left behind. Why are we talking about this? A lot of us take the easy way out. Symptoms go away. Oh, I don't need to go to the doctor or the hospital because I'm all better now. Well, you don't really know why it happened. It could be a warning sign to something worse, because TIAs are warning signs in every 6 patients with a TIA, one of them goes on to develop a stroke. That's a lot of people. You do not want to have a permanent disability, so you should really get attended if you have any symptoms that are even temporary. So what happens when you lose blood flow to the brain? Roughly 2 million neurons are lost per minute of lack of blood flow to the brain. That's a low estimate. People are now saying you lose 10 times as many in some people who just cannot tolerate. So if you think about those of us who know how to swim, there are those who can hold their breath underwater for a very long time, and those of us who can't even bear to hold it for a few seconds at a time. It's the same idea. Some people can handle lack of blood flow to the brain and only maybe lose fewer neurons than those who lose a ton more neurons. So there's no way to know which of us will lose it faster than those of us who might be able to survive a compromise. So the idea is not to wait and see which of us can hold our breath longer. It's just important to just go to the hospital right away. What happens if you do lose brain? Well, the brain ages more quickly after a stroke. For every hour the brain loses blood flow, it becomes older by 4 years. So if this talk is about an hour long, and that's how long the brain has been without blood flow, you'd be 4 years by the time you stepped out of the classroom. Just imagine, 3 hours is a decade. So it's really important to keep this in mind and not jeopardize your own well-being for fear that it might be something worse and you don't want to hear it, or for being nonchalant. So what are the symptoms? Well, sudden numbness or weakness of the face, arm, or leg, oftentimes just involving one side, but can sometimes be both sides. Sudden confusion, difficulty speaking or understanding, suddenly not being able to see in one or both eyes, sudden difficulty walking, maintaining balance, coordination, or dizziness, or sudden severe headache with no known prior cause. Obviously, it's not comprehensive. There can be other signs and symptoms, but these are the big ones. And the key here is many of these can start suddenly. The sudden nature of symptom onset should tip you off to something being really bad. So if you're having stroke symptoms, one of the ways to remember many of them, is to use the mnemonic be fast. Each letter stands for something. B, does the person have sudden loss of balance? I is E. Has the person lost vision in one or both eyes? F is for face. Ask them to smile. Does it look crooked? Do they have a droopy face? The side that doesn't move is the weak side. Arms. Have them hold up both arms. Does it drift downward? Are they able to hold up one arm? Same thing for the leg. And then you can do the same for numbness. You touch them on one side or both sides, and do they have feeling or loss of feeling? Speech. Have them repeat a simple phrase. Ask a question. Are they slurring? Can they answer? Can they understand? If any, we're not talking all, if any of these symptoms are detected, it's time to call 911. Not to second guess, not to wait and see if you get better or worse. Right away, you call 911. And note the time when the symptoms were observed and when they were last known well, because that often determines what treatments you might be eligible for. When you notice them does not necessarily mean when it started, but it is important to know when you were okay and when did you notice you were not okay. How can you treat ischemic strokes? The first order of business is to get to the place where you can be evaluated and treated. Eligible patients might be eligible for a clot-busting medicine called TPA. That's why it's important to come right away and not wait, because you can't give these treatments to everybody no matter what time they come. Time is a determinant of who gets this treatment. It's been approved for 3 hours and with some caveats up to 4.5 hours. The sooner you get the treatment, whatever that could be, the less likely your chances of permanent disability and improved survival. So time is essential in stroke treatment. In addition to clot-busting medicine, which is given via an IV, you can also get clots removed if they're big enough to go after. So this is an example here where this artery shows a blockage right there with no blood flow to this side. So it's the right side of the patient's brain which controls the left side of the body, so they can move their left arm, leg, face, and had slurred speech. Sounds like a stroke. So we confirmed it with no lack of flow in this part. And I took this patient to remove the blood clot using this device called a stent retriever. We have many devices. This is just one example. This big clot was pulled out, and you can see what was missing is now open. This is the before picture. This is the after picture. So there could be other procedures. There might be narrow artery in the neck that formed a blood clot and that went up and caused the blockage. You might be able to improve the narrowing in the neck artery so it doesn't do the same thing again. You might be eligible for blood thinning medicines like aspirin, Plavix, or stronger blood thinning medicines that might be necessary to protect you from forming blood clots down the road. There are other things that can influence your stroke risk. Having high blood pressure is a big risk for stroke. High cholesterol, diabetes, smoking, illicit drug use, excessive alcohol use, sleep apnea, obesity, these are all controllable risk factors, meaning you have control. With the help of your doctor, you can keep these from contributing to a future stroke risk. Preventing a first stroke and a recurrent stroke requires good control of these things. You can't control yesterday. You can't control the past where your history includes diabetes or hypertension or your family history or what you ate. But you can control these things going forward, and that's very important to recognize. This is why 80% of the strokes are able to be prevented if you can control these things. So lifestyle is a big one. People discount this or overlook this. It is not easy to do, but this is actually under your control because only you can eat for yourself. Only you can sleep for yourself. Only you can exercise for yourself. So if obesity is an issue, it's important to rectify that and engage in reasonable physical activity. Walking 20-30 minutes a day is very helpful. Avoiding heavy or binge drinking, and that's defined as more than 1 glass of wine in a 24-hour period. So medical definition is very different from society's definition, and that's important to recognize. Your body sees an onslaught of alcohol. You may be able to hold your own liquor. That doesn't mean that your body doesn't suffer the consequences of that onslaught. Illicit drug use, cocaine, amphetamines, just some examples. Cigarette smoke, both first and second hand, increases the risk of stroke by 2-fold. Here are some medical risk factors that's important to keep under control. Keeping your blood pressure less than 120/80 is important because high blood pressure increases the risk of stroke by 1.5 times. Diabetes increases the risk by 4 times. Obstructive sleep apnea is a big one. High cholesterol is a big one. Atrial fibrillation increases the risk of stroke by 5 times. So very important to work with your doctor and not put it off. Again, many of the things that are really, people are aware of these things. It's just important to make a habit of these things. High blood pressure can be controlled by taking medicines, but also doing other things which can maybe minimize the need for medications, like exercise, managing your response to stress, maintaining a healthy weight, not including extra sodium in your diet, diminishing alcohol intake. Other things, watch what you eat. I mean, you might be eating salad and thinking, why is it that I'm eating salad and my cholesterol is high? What do you put on your salad? Do you put salad dressing on it? Is it rich with mayonnaise-based dressing? You know, things that contain saturated fats, trans fats. These things matter. Weight loss matters. Your heart has to work harder if you have more weight than your body can handle. Eating 5 or more servings of fruits and vegetables every day, exercising 30 minutes every day, stopping smoking and being exposed to secondhand smoke, avoiding illicit drugs, and treatment of sleep apnea are all parts of how you prevent future stroke risk. What can you not fix? You can fix your own personal history or family history of a stroke, TIA, heart attack. Why? You can't control yesterday. It's gone. If you're 55 or older, you do have a risk factor for stroke, so you can't control your age. We all would like to age backwards, but we haven't figured that one out yet. African Americans have a 2-fold risk of stroke. Hispanics and Asians have a higher risk of stroke than Caucasians. You can't control these things. So you need to work harder to control the other things that you can, because those you might be able to modify. More women die of stroke than men. Remember one of those early slides? I said 60% of women suffer from stroke. And remember, women tend to be caregivers. So if they suffer from stroke, they bear the brunt of more consequences, either as victims of stroke or those people that they depend on, who tend to be other women. Women have a higher lifetime risk of stroke than men for a number of reasons. Nobody really knows which one's the dominant one, but one of them is that they do live longer. So it's like saying, if I cross the road more times than somebody who doesn't cross the road, I have a better chance of being run over by traffic. You know, I mean, it's just a matter of being exposed to risk factors. Okay, so if somebody did have a stroke, it's important to do everything you can to minimize the chance of a future stroke, because 1 in 4 people who've had a stroke are at risk for having another stroke. So if your doctor thinks that being on a blood thinning medicine is important, be it aspirin, Plavix, Coumadin, Xarelto, Eliquis, these things can make it difficult for blood to form a blood clot. And based on your particular circumstances, some of these might be the way to go. Lowering your blood pressure to normal levels, lowering your cholesterol to normal levels, keeping your diabetes under control with medications, diet, and exercise, wearing a CPAP machine for sleep apnea treatment, and aids to stop smoking. These are all things that go into preventing another stroke. Okay, so this slide is a very powerful slide. Saving a minute of lack of blood flow by seeking immediate medical attention might save a day of loss of healthy living. 15 minutes translates to a whole month. Ischemic stroke patients need to come to the hospital right away so that if they're eligible, they might be able to get the clot-busting medicine within 3 hours, and for some patients within 4.5 hours. But you don't know whether you're having an ischemic stroke or a hemorrhagic stroke, which I'll get into briefly next. You just need to call 911 and get into the hospital right away, because that's when you can start getting evaluated and the treatment can begin. Remember, stroke is treatable, but stroke is also preventable. Okay, so let's shift gears and talk about hemorrhagic stroke. What is it? Hemorrhagic stroke is bleeding of a blood vessel. Something can be very small blood vessel that can bleed, or it can be a big blood vessel that can bleed and cause a lot of bleed. It's a pipe. Blood vessels are pipes. They can rupture, they can bleed. So that's a hemorrhagic stroke. And 15% of all strokes are hemorrhagic strokes. They disproportionately contribute to 40% of all deaths from stroke. So bleeding in the brain can be a catastrophic neurologic emergency. So again, very important to come right away. And really, one of the reasons why you ought not to take aspirin if you have a sudden neurologic problem is you don't know whether it's a blocking kind of a stroke, an ischemic stroke, or a bleeding kind of a stroke, a hemorrhagic stroke. And if you took a blood thinning medicine like aspirin without knowing which one it is, you may be doing the wrong thing if you had a bleeding kind of a stroke. You can also have bleeding due to abnormal brain blood vessels like a malformation or an aneurysm. Nevertheless, the sudden rupture of a blood vessel or an aneurysm or malformation can damage brain cells in the same way that a sudden flood can cause to a neighborhood. Water damage happens. Homes, streets, everything swells, things back up, right? So in the brain, you can have damaged brain cells, increased swelling, increased pressure on the brain. So if you start thinking about the consequences of brain blood flow by using analogous situation with pipes, you can start to make a little bit more sense, because you deal with them every day. We all live in homes. Hopefully none of us have to deal with blocked or burst pipes, but that's what we're talking about today. High blood pressure and aging brain blood vessels actually are the most common cause of brain bleeds after trauma. We're not talking about trauma. If I get hit over my head, I can have a brain bleed, but that's different. We are talking about things that are diseases that can affect our brain blood vessels, that can increase the risk of chance that they can bleed. High blood pressure can cause weakness of the blood vessel wall. So if you think about a water balloon, you keep pumping it with high pressure water, eventually it can burst. Well, your blood vessels, arteries and veins, have a certain limit to how much pressure they can handle. They can rupture. Other things that can cause brain bleed, I've already mentioned head injury, bleeding disorders. You're just prone to more bleeding than everybody else. It can cause you to bleed. You could be on blood thinners. Blood thinners are important, but there's nothing in life that's a free lunch. Everything comes with a risk. You weigh the risk and benefit. If the risk and benefit says that you are better off being on a blood thinner than not being on one, you're put on a blood thinner to protect you from something that can form a blood clot. But it's important to recognize that if you bled while you're on a blood thinner, the bleeding can be more. The blood thinner don't necessarily make you bleed, but they can prevent you from forming a blood clot sooner than somebody else. Okay. Next slide is, what are the other risk factors? Well, we already talked about high blood pressure. Other causes could be ruptured brain aneurysm, trauma. Aneurysm development is still a mystery, but some of the things that we know, again, include high blood pressure, cigarette smoke, both first and second hand, binge drinking, and recreational drug use. So again, I'm listing the things that you can control. You know, we can talk about all the things you cannot control, but the idea is you can take something away from the talk today and see how you can employ it in your life to minimize the chance that you have to see anybody like me in the hospital for a stroke. Hemorrhagic stroke treatment. Same idea. Why did the blood vessel bleed, and how can we treat it to prevent it from rebleeding? So if you came in with high blood pressure, we want to lower your blood pressure. If you were taking a blood thinning medicine, even if that was not the cause, we would stop it so that we don't increase the chance of bleeding, and then maybe reverse the blood thinning medication's effect. These things can only be in the hospital. If you have an aneurysm, we might be able to fix it. If you have a malformation, we might be able to fix it with minimally invasive procedures these days, but sometimes you might need a combination of treatments. Surgery to remove the pressure from blood clots, which can cause additional damage, just like flooding can cause additional damage to a neighborhood after lots of rain. And X-ray based treatment for certain types of malformation. Again, things that can be done at the hospital, but important to recognize that time is of the essence. If you recognize something suddenly abnormal about you or your loved one, if you don't come to the hospital right away, you miss the window of opportunity for many of these time-sensitive treatments. Okay, so here's a cartoon of a person with a blood vessel that has a bubble called a brain aneurysm. In the past, they used to do open surgery, and it's still done, but less and less so. You can shave the hair, make an incision in the scalp, peel it off, drill a hole in the bone, remove the bone, and get to the artery, this one that has this bubble, and pinch it from the outside so that it doesn't fill with blood anymore. And this is a clip, so it looks like a clothespin, but the idea is the same. You exclude it from receiving blood from this main blood vessel. These days, you can do minimally invasive treatments by getting through the artery in the leg and putting a small, slender, hollow tube called a catheter, and progressively smaller catheters to insert coils, which are miniature metal slinky type things, to fill the aneurysm like you fill a pothole in the road so that blood doesn't fill in the space. And if blood doesn't fill in the space, you can't rupture the aneurysm again. So the idea is to prevent the aneurysm with filling with blood in both cases, but this is the modern approach. And here are some other examples. This person has this big arteriovenous malformation with multiple aneurysms and a tangle of abnormal blood vessels. And you can treat the risky parts of this aneurysm and then over time try and minimize blood flow to this by minimally invasive methods and eventually remove what's left with surgery or radiation. So we have modern treatments for terrible diseases like this, and again, important to come right away. What are some complications of strokes? Strokes are not benign. I told you the leading cause of adult disability is due to stroke. It can leave somebody paralyzed. You can have permanent contractures of the arm, leg, very painful. People can have difficulty walking. They might have difficulty swallowing. They might have difficulty talking. They may develop pneumonia. And that's a consequence of poor muscle coordination in your throat. They might have difficulty thinking, not be able to multitask anymore, not remember, have difficulty dealing with things emotionally, develop depression, develop disinhibition, become angry or sad, have behavior problems, and not be able to take care of their own needs, develop urinary retention, bladder control issues, incontinence, may develop seizures. Dead brain is very irritating to normal brain, so it can develop seizures. They can develop bed sores because they're bedridden. They can develop blood clots because they're immobile. So you can see the list is fairly long, but this is, again, not a complete list, but it gives you an idea why it is so important to prevent a stroke in the first place and seek immediate treatment if you can to minimize as many of these long-term consequences of stroke. If somebody did have a stroke, rehab can be a key component of their recovery because rehab doesn't bring back dead brain. Rehab helps teach the brain that's alive to learn new pathways, to learn the task that was lost because of the stroke. It's like learning a new language or a hobby or a task or a skill. So the focus is on restoring function to permit a return to independence as best as possible. Not everybody can return as they were previously, but if you don't try, you can't return to previous or any level of recovery. So different types of rehab exist: physical, occupational, speech, cognitive. Can be done at rehab depending upon how severely you're disabled. Could be at home, could be in an outpatient facility, could be a continuum. Somebody goes to rehab, then goes home, and then goes to outpatient. So it is important to think about rehab in those terms. Rehab and nursing homes are not the same, but many people have misconceptions. So important to keep the distinction in mind. And then again, cannot emphasize how important it is after a stroke to recognize that risk factor modification forms the cornerstone of avoiding the next stroke. So everything that we talked about. So this is, I can't say this any better than what this person said, so I'll read it for those of you who are not able to see it. I had a stroke when I was 49 years old. I'm 67 now and I've gone almost 20 years without another stroke. Until I had my stroke, I didn't do anything good for my health. I had high blood pressure, I was overweight, and I smoked. When bad things happen to people, they tend to think, why me? But when I think about my stroke, I think, why not me? I had all the risk factors and wasn't taking care of myself like I am now. I've learned a lot of important lessons from my stroke, which have caused me to change my eating habits, quit smoking, and really control my high blood pressure for the first time in my life. I hope people realize they can prevent stroke. It doesn't have to happen to them. This is Ted Turner, famous personality who's also a stroke survivor. Cannot have articulated it better, and I think that should be the take-home message. So stroke is preventable, and if somebody does have stroke, it is treatable. So thank you for your attention, and any questions, happy to take.
Yeah, you can open in that corner where the purple box is. And then crush the bubble. Let's see any questions.
Is there a handout available that outlines this lecture? Well, you might be able to get slides.
Yeah, from the personnel.
Yeah, from the lifelong. How long, here's another question. How long does it take to get imaging results once somebody gets to the treatment facility? It's actually one of the fastest things that you can get, within minutes. Good question. That's how we make the diagnosis. Somebody coming in with chest pain can get an EKG in the ambulance. For us, the EKG is the imaging studies. So imaging studies cannot be done yet in the ambulance in a cost-effective way, but should be done when you get to the hospital. Any other questions?
DC, it says what imaging is done.
So it depends. Oftentimes we start with a CT scan, and then we might look at blood vessels using CT, called a CTA, of the brain and the neck blood vessels. If somebody is not able to get a CTA for various medical reasons, we might get MRI and use the MRI to get additional information, including stroke information and blood vessel information. Does imaging have to be performed prior to getting clot dissolving medicine? Absolutely. We need to establish whether you have bleeding in the brain. If you have bleeding in the brain, you cannot get a clot dissolving medicine because your problem was not a blood clot. It was a brain bleed. That said, just because you don't have bleeding in the brain, which the imaging has excluded, doesn't mean that you automatically get clot busting medicine. There are certain criteria that you have to meet, certain exclusions that should not be present. For example, if somebody has a history of bleeding, Giving a clot-busting medicine to you for the stroke may be the right thing to do, but it might increase the chance of your bleeding tendency, which can jeopardize your life. So that's one of the reasons why you need to come right away, so we can figure out what would be the right diagnosis and what would be the appropriate treatment. One of the things I will make sure that to emphasize, if your loved one has a stroke or symptoms of a stroke, in addition to calling 911, it is very important to give them your cell phone number, make sure your contact number, make sure to keep it on and answer any and all phone calls without screening them. You're not going to know the number of the hospital that's calling you. You're not going to necessarily know who's going to be calling you. But if you're not available, important information is not available to the treatment team other than that they got picked up from home or somewhere else with symptoms, and that can hamper the kinds of treatment we can give them. So very important to keep your cell phone on or contact information available. Give it to the EMS personnel. Tell them that the doctors who are seeing the patient when they arrive can please call them with additional information, need for additional information. Also important to make sure that you give the team, the EMS team, a copy of your medications, because that might determine different kinds of treatment. Okay, here's a question. Blood thinners, how often do they cause stroke? Can patients on blood thinners do anything extra to avoid stroke? Blood thinners don't, so I want to emphasize this. Blood thinners are not causing you strokes unless you are, you've taken an extra dose when you shouldn't have, your blood has become too thin, making you at risk for bleeding. Blood thinners themselves, when taken correctly, do not cause stroke. It's important to recognize that. But if you have too much thinning of your blood, it can put you at risk for bleeding. So what can you do to avoid? Always work with the prescribing physician and their team to make sure that your blood thinning medicine is taken correctly. If you're taking Coumadin, very important to keep the INR number in the range that you're supposed to be. Important to avoid leafy green, vitamin K, introduction of new things or medications into your diet without consulting the people who are prescribing Coumadin. This is specific to Coumadin. If you're taking some of the newer blood thinning agents or aspirin or Plavix or any of those other things, and Coumadin, keeping your blood pressure under good control is important. Because if your blood pressure goes high, your blood vessels can be like a water balloon and then can't handle it and can rupture. Being on a blood thinner will prevent you from being able to clot off the leaky blood vessels. So again, blood thinning medicines do not directly cause a stroke unless it's been overdone somehow. So another question, does this mean people who come to the hospital with stroke symptoms are treated without delay? It depends where you go. So I'll give you an example. If somebody has a polytrauma, meaning they got injured in a motor vehicle crash, broke every bone, they're not going to go to the nearest urgent care center. They're going to go to level 1 trauma center because they're equipped to treat trauma very quickly and appropriately. However, if they don't have such a hospital in their neighborhood, they're going to go to the nearest hospital to get stabilized and then go to the trauma center. Obviously, the two different scenarios can impact the outcome. One patient may be able to survive, the one that got to the highest level trauma center. The other one may survive, but might be really tenuous because unfortunately the delay was because of access to care. Stroke is no different. If you come in to a local hospital that's not equipped to treat strokes quickly and effectively, they may recognize their limitations and move you to a higher level hospital. But in the process, you've lost time. But if you come to the highest level stroke center, then you get the treatments that you're eligible for right away to minimize the chance of long-term disability. That said, the first order of business is to recognize when you were normal and when you were noticed to have abnormal symptoms. If too much time has passed between when you were normal to when you had abnormal symptoms, you may not be eligible for the timely treatments that would increase the risk of other bad things for you than somebody who recognized the symptoms right away and were normal not too long prior to that and came right away. So these are things that require a little bit more nuanced discussion, but the information and the message is the same. If you have symptoms that are suspicious for stroke, then you need to call 911 right away so that they can take you to the most appropriate highest level hospital right away to minimize the chance of treatment delay.